All right, we're going to start talking about dynamic stabilization by talking about our muscles. So, dynamic stabilization is stabilization when the knee is moving. So, for muscles and it being a hinge joint and only moving in the sagittal plane, so only doing flexion and extension, our muscle groups are pretty simple where they're anterior, posterior, medial, and lateral. So, our anterior muscles are our quadriceps that are coming up from our hip all the way down past their knee and attaching at this tibial tubercle. They're unique because they're all this is one of our strongest muscle groups in our entire body, and they're going to come down and attach to a patella tendon where the patella is embedded in it, and it attaches right here. And when they tighten and they contract, it extends that knee and straightens it out. Conversely, you have the big hamstring group, which are three muscles that come down and attach just past the knee, and they're attached at the butt bone there, and they're going to come down and they flex the knee. So when they tighten, they are flexing the knee. They also are decelerators, so they decelerate our leg, where our quadriceps are known as our accelerators. They speed us up. We'll get to more of that when we talk about hip and thigh. Then when we're looking medial lateral, so whenever you're trying to figure out your medial lateral on the knee, find the fibula, that is going to be lateral. So on the lateral side, out here, you come all the way down from your hip, all the way down just past your knee, right here on what's called the Gerdy's tubercle. Can't see it, but it's just a landmark here where we have our IT band attached. So our IT band is just a fascia. It's not really a muscle. It's probably more tendon-like than anything, but it's just a thin layer of a thick band of tissue that goes up through a TFL, which is tensor fascia lata, and it's just this fascia, and it's can get really tight, and we also often refer to it as like when it's being overused or overloaded. It gets almost like saran wrap and shrink wraps, like with heat, and gets really, really tight and can cause a lot of pain here. On the medial side, the medial muscles are going to adduct, so they're going to pull you in, where that outer muscle was going to pull the leg out and AB duct. And then so we're going to go to these medial muscles called the adductors, and they're going to adduct and pull the leg back toward the body. And they attach here just above at the epicondyle. So you have the big condyle of the bone, and right there above that, that's where the adductor tubercle is, where the adductor muscles attach. You also have another adductor muscle that works in your groin muscles called the gracilis, and it attaches just a little bit further, and that is our green band here. I have these three colors here to represent the sergeant muscles. This is important to know and remember. So you have sergeant muscles, sartorius, gracilis, and the semitendinosus, and they attach at one site called the pes anserine. And there is a bursa there because we have three tendons that are for muscles doing all different things, all different actions. They're not working to group as a group together. So because of that, they're being contracted at different times, and it creates a lot of friction. So there is a bursa there. So pes anserine bursitis is a very common area and a common injury to happen with overuse pain, especially when people are training and doing hills and stairs and maybe changing their training, maybe doing bike where they haven't done bike before, because these muscles work with the hip and the knee. And so anytime the knee is really bending and straightening with the hip flexing and extending, you will get that. So the sartorius runs from the medial knee across the quad. And then the gracilis runs just straight medial. And then the semitendinosus is a hamstring muscle, so it's running posteriorly. So they're all working to do flexion, adduction, and helping with hip flexion and knee extension. So we're doing different things here, and that's why we get that. So it's important to understand the sergeant muscles attach at the pes anserine, and the IT band attaches at the Gerdy's tubercle on the outside. And then the quads are anterior and they extend the knee, and the hamstrings are posterior and they flex the knee. So if you have any questions about muscles, let me know. And then otherwise, we're going to make sure you understand the other dynamic stabilizers in the knee, which are the ligaments.